The topic being investigated is to see if incorporating yoga sessions a couple times a week will have a positive effect on health. It's important for people in this field to explore different ways to maintain a healthy lifestyle and to promote them to other people. It's good to try new things and explore different areas of exercise. This study is being completed to educate the population who is unfamiliar with this activity and is wanting to expand their knowledge on different ways to increase or maintain overall health for individuals. The hypothesis is that individuals who incorporate yoga on a day-to-day basis have a better overall health, both mentally and physically. In order to test this hypothesis is by first asking female and male athletes that have no experience with yoga to volunteer as subjects in the study. Then, by testing their heart rate and mental well-being throughout the course of the study to determine if there are positive effects. This study will be using a heart rate monitor in order to test the subject's heart rate before and after the yoga session. Before and after each yoga session, the subjects will be given a mental health rating to fill out. The study will be conducting a yoga session once a week for 5 weeks in order to classify if there is a positive effect. Data on heart rate and mental well-being will be taken directly before and after the end of the study. There have been many studies done to calculate the benefits of yoga on people's health. One particular study measured individuals' blood pressure and heart rates directly after a yoga session. The results of the study show that heart rate was elevated in each individual during the session. Other studies focus on the mental well-being side of yoga. Research suggests that yoga helps decrease stress and anxiety.
Now moving on to the methods. The participants in this study included 5 student athletes from Montreat College. The ages ranged from 18 to 21, and the subjects had no prior experience with yoga. The materials used for the study included an informed consent form, a 1-question survey based on mental health, a heart rate monitor, a 10-minute yoga session video, a yoga mat, and a quiet space. The survey was rated through a 1 to 10 scale. The participants were to analyze their stress prior to yoga sessions and again afterwards. The heart rate monitor was used to collect the subject's heart rate before and after each yoga session. Before beginning the yoga session, the participants signed an informed consent form. Afterwards, the subject's initial heart rate was taken prior to beginning the yoga session, and the current mental well-being rating was analyzed through the survey. This was then repeated again after the yoga session was completed, except for the informed consent form. Once the participants answered the survey, filled out the consent form, and their heart rate was taken, they began the yoga session. The yoga session lasted 10 minutes, and once it was completed, their heart rate was taken immediately afterwards, followed by the survey. Participants completed this process once a week for a period of 5 consecutive weeks. The test results were analyzed through gathering data before and after each yoga session to then be presented with a paired t-test. The paired t-test was used to assess the relationship between yoga benefiting mental and physical health. The data collected from the participants' heart rate and stress level for each week is presented through a table. This study is projected to have the best outcomes because it is taking into account each person's health level and tracking it as it goes. Now moving on to the results. Subjects completed 100% of a total of 5 yoga sessions per week over a 5-week period. Outcome from the study showed significant relationship with the yoga and reduction of stress levels. Over the course of 5 weeks, stress levels dropped greatly, with a mean average of stress levels of 6.28 prior to yoga and a mean average of 1.72 after the yoga session. Yoga benefited each participant's physical health due to the participant's heart rate mean average being 63.12 prior to the yoga session and 14.68 post-yoga session.
Moving to the discussion. According to the results, incorporating yoga workouts a couple of days a week has a positive impact on health by lowering stress and improving mental and physical well-being. We began our research by measuring the subject's heart rate and mental well-being before and after each session to see if yoga has any positive effects. We measured the subject's mental health by asking them to rate their stress level on a scale of 1 to 10, with 10 suggesting severe stress and 1 indicating no stress at all. The stress level table shown above indicates that all 5 of our participants seemed to be stressed before the yoga session started. But after the yoga session, everyone's stress level appeared to have dramatically decreased. Every participant is a Montreat College student who seems to be stressed prior to each yoga session, which may be attributed to the fact that they are in college and perhaps other factors. It seemed as though participant C had the most positive impact on incorporating yoga once a week because their stress levels were always high before each yoga session and lower than others after. The study conducted also showed that the participant's heart rate mean of 63.12 before the yoga session and 141.68 after the yoga session. It seemed as the yoga sessions went on throughout the week, participants' heart rate after the yoga session decreased slightly. And moving on to the conclusion. The purpose of the study is to see whether incorporating yoga sessions a couple of days per week has a positive impact on health. This research is being carried out to help those who were unfamiliar with this activity and wish to learn more about how to improve or sustain good well-being of individuals. For the research, we found 5 subjects for the study, all whom were athletes at Montreat College with no prior yoga experience, and we put them through a 5-week yoga course in order to test their overall mental and physical health. The results were considerably successful because we were able to test our hypothesis and discovered that yoga does decrease stress and improves mental well-being and physical well-being. The results of this study turned out very well. We found out that yoga significantly lowered stress and increased positive mental well-being. We saw that after each session, the subject's heart rate was elevated so that it fell into the moderate intensity category. This means that yoga is a great form of exercise and therefore positively increased physical health. We also tested blood pressure before and after the study, and there was not enough evidence to support whether yoga lowered blood pressure. All the subjects were athletes at Montreat College and already had a healthy blood pressure. There are many different ways to get active, but yoga has shown to not only increase physical health, but also increase mental well-being as well.